This will be one of the single most important videos that I will ever post on this channel that you need to hear if you're preparing for or thinking about bariatric surgery. A lot of people don't realize that bariatric surgery is more mental than anything else. Countless baries will tell you that in the bariatric community. Many of us were so surprised to see what a role our psychological preparedness actually played in being able to have this surgery and endure what it entailed successfully. My name is Sonia Insiber, and I had bariatric surgery, Roux-en-Y gastric bypass, on 9/6/23. It's absolutely the best decision I've ever made in my life, and I started Bariatric Baddie as a community to help you thrive before and after weight loss surgery. Lots of really great resources coming here, so make sure that you hit that subscribe and the bell so that you don't miss any of the videos as they come out. And always check the description box or the about me on this channel for new things coming. There will be lots in the months to come. Many baries will tell you after starting or going through the journey that it is 90% mental, 10% everything else. And that's for good reason. So you being psychologically ready and prepared and knowing what to expect walking into it is critically important. So when you're approaching bariatric surgery and your program requires a psychological evaluation, do not take it lightly. It is actually going to help you be that much more successful in surgery. And if for some reason you go into the psychological evaluation and it's determined that now isn't the best time for you, trust that and just take it as a way for you to better prepare when it is your time later. Now, before I dive even deeper into this, I want to just put a disclaimer out there, as I do in most of my videos, that I am not a medical professional. I'm certainly not your medical professional, even if I was. You always want to check with your medical team, defer to them when it comes to questions specific to you and your health. Though this area is meant to be a peer support community, a place where you can come for resources and a firsthand account of what it's like as a bariatric surgery patient that's been very successful with it, it is not intended to replace medical advice. Now let's get a little bit deeper into the psychological evaluation, what it entails, what it looks like, what kinds of topics might come up, what things might be discussed or are important for you to consider when you're going into bariatric surgery, so that hopefully you can go into that psych evaluation almost excited about it, because it's going to be a piece that helps you be even more prepared for this surgery. Now, to make myself even better prepared for this, to share some different perspectives, I actually reached out to multiple baries in the community that I'm connected with for their feedback on their experience, and I'll be sharing that here, reading some of that out to you. So if you happen to be one of those, I thank you for giving me input. Really appreciate you guys. And I just wanted to make sure that anyone watching this video really understands that we all have to go through it to some degree. And the topics that are covered are all topics that we definitely agree are important for you to think about and talk about before having bariatric surgery. So the questions I asked my friends in the bariatric community was: 1, did they have one? And if so, was it mandated by insurance or optional? 2, what kind of questions were they asked? And 3, any tips that they would have for someone preparing for that kind of evaluation. I'll go through their responses first, and then I'll add my commentary after that. My program included mandatory psych evaluation, but mine was just an informal chat after they found out. I had already been in therapy at that point for 3 years, and personally, I would recommend therapy before surgery because I believe this battle is 90% mental and 10% about the food, if I'm honest. The only topics I specifically remember are things like how often I drank alcohol and if I ever had an eating disorder. One topic I wish mine had covered had been the financial impact of losing weight and having to replace your wardrobe. Mine was required by the program I went with and an insurance requirement to have the surgery. A good amount of questions to see if I had a history of binge eating, emotional eating, talked about the support I had, what life would look like after surgery, and adjusting to the changes after that. Mine was mandated by insurance, and my program also required it. Mine felt pretty informal since I was already in therapy. They asked some questions about my psych history and my history of binge eating and emotional eating, but it was much less involved than what I expected it to be. I was actually really nervous about mine. I was worried that maybe because I had a known history of emotional eating, binge eating disorder, and eating as stimming, that they might not approve me as a surgical candidate. But the fact that I was actively pursuing treatment for mental health alongside the weight loss surgery probably helped. My advice would be, if you do have a disorder eating, find a therapist. Try not to feel anxious about the psych evaluation. Be honest and open. Mine was self-pay and I did not have a requirement, but I had one when I was jumping through my insurance hoops only to find out it had 0 coverages. Lots about my eating disorder and trauma. It's on the medical charts. To be honest, it's better to wait to get more help before having surgery to be successful than to rush and be regretful and do all the risks for no reward. Now for me, I did not end up having a super formal psychological evaluation. I was self-pay, and so I had an informal chat with my surgeon directly where he asked me questions about my history with food, my habits, how much I knew about what the lifestyle changes might look like moving forward and how prepared I was for that, as well as what support I had at home, like what my support network looked like. We also talked a lot about my goals in terms of the surgery and why I thought this was the right answer for me at this point. And so that was certainly one time where I was able to step back and really think about those factors. So as you can see, between myself and the Barrys that were kind and generous enough to share their experiences as well for this video, the psych evaluation is a normal part of the qualification process and definitely a critically important one. Whether it's something that is mandated by your program or something that you do informally with your doctor, it's definitely a piece that you want to make sure that you do so that you can confront all of those topics and issues before having surgery. There are so many aspects of the bariatric surgery journey that many people don't realize will start to play with your head, like tricks on your mind. From your body drastically changing, from you having lingering complications or issues, to you having new challenges to overcome, like one of my Barry friends mentioned about the factor of buying new clothes. That's something not a lot of people think about because you will have a lot of clothing on hand that no longer fits. There's also the aspect of personal relationships, because one thing that happens with bariatric surgery, for example, there's like 50% of marriages that divorce after bariatric surgery at some point, and relationships that change. You'll have friends that celebrate with you, and there'll be friends that are going to be really envious of you and might tell you that you're being brand new when really all you've done is made yourself healthier and happier. You yourself may also become a different person. Your attitude may change. Your confidence may change. So there's all of these aspects that you have to work through mentally when you're going through this journey. And yes, there are aspects of this that deal with psychological things related to the food and just like the physical parts of it after surgery when you can barely eat anything. When I first came out of my surgery, that first week you're on completely liquids. And then once you're finally able to eat, you find that the only thing you can eat is a small baby spoonful of something super pureed or soft. For me, that was refried beans. And it was the best refried beans I had ever had in my life because it was the first real food I was able to put into my mouth. But again, that plays a number on you. When you find yourself at the table dining with the rest of your family and they're able to gobble down an entire plate while you're sitting there only able to have a few spoonfuls, that can really play tricks on your mind. And if you've dealt with different vices like alcohol, for example, and you have bad habits when it comes to drinking, that is something that can dramatically increase your chances for complications and even death after having surgery. There are a lot of examples of people that end up starting back drinking too soon after surgery, quickly become addicted because your body metabolizes things differently, and then find themselves dealing with an extreme version of alcoholism that might even put their life at risk. Unfortunately, there have been many people in the community that have been lost because of that. There are also parts of this where you'll be in communities with other Barrys and you'll find that not everyone is equal in terms of being supportive to your journey. There are sub-communities within the bariatric community where people are highly supportive and loving and positive, and then you get the other side that's only complaining all of the time. People that weren't fully ready to have the surgery and now hate it because they think it's the worst thing they've ever done for their bodies. And there's also people that are dealing with countless complications that are also finding it very hard to be happy about their surgery. So, All that to say, the main point I really want to make out of this video is that having the psych evaluation is one of the best things that can happen to you before your surgery. And for you to get the most out of it, you need to be completely honest with yourself and whoever it is that you're talking to. If there are lingering things that you need to confront, habits that you need to first break before having bariatric surgery, do yourself the favor to take the time to do that before moving forward with the surgery. This surgery is no child's play. It is not a piece of cake. It is very, very hard. So you want to do everything in your power to set yourself up for the best success moving into it before you do. Do not underestimate the importance of the mental aspect. Do the work. Make sure you're in regular therapy. If it is something that you need, you'll need it even more after surgery. And make sure that whatever it is that comes up during these evaluations is addressed fully before moving into surgery. Be prepared to honestly and openly talk about your relationship with food, your expectations out of the surgery, your relationship with friends, loved ones, family, your support network, your living situation, and the habits you're ready to commit to. And try not to go into it with fear. Because the worst thing, which might actually be the best thing for you, is that it's determined that you're not ready to do the surgery just yet. And if that is the case, you'll likely get a playbook or some kind of directions on what you can do to get yourself there later. And I say that's the best thing that can happen to you because if you force yourself to go into this surgery too soon, you are going to set yourself up for a very, very difficult road ahead. All right, so I hope this video helps you be prepared and makes you feel a little more at ease about going into it. It is something that all of us have done to some degree, and it is something that all of us that have gone through this surgery absolutely believe in. You are going to be very happy that you did this later too. Now, if you want to check out the whole series and maybe even the first video that outlines all of the topics related to the qualification of bariatric surgery, you can find that video right here. It also links to other videos that break down those topics in detail, just like this one for psychological evaluation. And though they may not all be there yet, make sure you hit that subscribe and that bell so that you can be notified as they drop. They'll all be coming very soon. I'm so excited for you. You're taking these steps, whether it's for now or for later. Make sure you drop me a question, a comment below if there's anything that I can answer further in relation to this topic or anything else dealing with bariatric surgery. Happy to do other videos for specific topics you might be interested in. And I'm always all ears for hearing where you're tuning in from, where you're at in your bariatric journey, how it's going so far. That always gets me so excited because I love to see people on the path of changing their life because it absolutely will in the long run. Again, I'm so thankful for having you here. I'm going to continue building this baby as big as I can, including a bariatric community off of this site where we can all connect even further. I'll put more information about that in the description and the about section for this page as more of it becomes published and available. So stay tuned, always check those areas, and make sure that you hit subscribe and that bell so that you can be notified as more of my videos come out. I'll see you guys on my next video.